Well, Virginia boasts one of the highest numbers of federal workers in the country, and as you know, many of them are not getting paid. You know, some in your party look at your election on Tuesday and the win in New Jersey and say that is permission to hold the line in Congress and refuse to fund the government or fold on the shutdown. Should congressional Democrats view your victory that way?
Absolutely not. Our victory was a victory that was based on a campaign that was addressing concerns related to costs and chaos. My campaign across the past 2 years have been focused on hearing the challenges that people are facing all across Virginia. It's rising costs in healthcare, housing, energy, and it's the chaos coming out of Washington that has been impacting Virginians so severely, beginning with the DOGE efforts, of course, continuing with chaotic trade policies, and now in this government shutdown. Virginians need to and Virginians want to see the government reopen. And my expectation is that we will see a Congress, a Senate, and ultimately a president driving us in that direction.
But should congressional Democrats open the government and then talk about health care?
The government needs to open, and it needs to open immediately. We need the president to demonstrate leadership, bringing people together, endeavoring to get through whatever negotiations need to get through, whether it's before or after. My priority is focusing on the needs and the devastation, frankly, that more than 300,000 Virginians are facing. And that's just the federal employees, government contractors. They will never get made whole. The entirety of Virginia's economy is impacted by this shutdown, just as we've been impacted by DOGE attacks, and the government needs to reopen quickly.
Well, and that's why I'm asking, because there are, 825,000 enrollees on food aid in the SNAP program. They're in limbo right now. You have immediate pain. So at what point do you weigh that against the potential of healthcare premiums? I mean, this pain is very real and very acute for people in your state right now.
And it's been going on now for weeks, weeks too long. The government needs to reopen because, in addition to the pain that we are already seeing,
but 8 Democrats could cross the aisle and do so.
Facing, we absolutely need everyone to vote to open the government. And that's not to say that the challenges we're facing within our healthcare system are not also immediate and acute. Even the passage of the One Big Beautiful Bill will have catastrophic impacts on Virginia, taking $26 billion out of our healthcare, leading to the closure of at least 6 rural hospitals. We've already seen 3 rural clinics announce their closure. Hundreds of thousands will lose their Medicaid. And so the impacts on healthcare are already catastrophic, but we cannot compound that pain by keeping the government closed.